Okay, so welcome to our webinar today. I'm thrilled that Dr. Zicherman and Karen Parsons will be leading our webinar on navigating adolescent substance abuse today. First, I'd like to start with sharing some SPC events and updates we have. First, we have an Instagram account, so please follow us on Instagram at Stanford_parenting_center, where we will be communicating parenting, evidence-based parenting advice. Next slide, please. And then Dr. Emily Ock will be leading a free webinar tomorrow, Thursday, October 7th at 12 p.m. called Parenting Through Uncertainty, talking with children about illness, death, and other topics we'd rather avoid. This will also be recorded and available through our Stanford Parenting Center YouTube channel, as well as through our Stanford Parenting Center website if you miss it. Next slide, please. And then following the free webinar, Dr. Ock will be leading a psychoeducational parent group for a deeper dive into this important topic. There is a fee associated with this class of $150, and we also do offer scholarships as well. Next slide, please. And then later this month, starting on October 15th, Kyle Cassidy, who is also part of our Stanford Parenting Center team, will be running another psychoeducational parent class called Parenting an Anxious Child. This has been has had really positive feedback, and so we're continuing to offer this class. Next slide, please. And then Karen Parsons, who's leading this webinar today, will also be offering a 6-part caregiver support class called Navigating Adolescent Substance Abuse and Behavioral Addiction. So the same topic, again, for a deeper dive, following an evidence-based protocol. Starting October 13th, it'll run every Wednesday at 12 p.m. Pacific Standard Time, and for a fee of $20 with scholarships available as well. I will be putting into the chat more information on how to register for all of these upcoming events. Next slide, please. Okay, so now moving on to the webinar at hand. Again, we are so thankful and thrilled to welcome our speakers today. Dr. Zicherman is a clinical assistant professor in the Stanford Children's Department of Child and Adolescent Psychiatry. At Stanford, he has developed the Recovery Clinic, where he treats youth with behavioral and substance use addictions. Dr. Zicherman is triple board certified in general psychiatry, child and adolescent psychiatry, and addiction psychiatry. Karen Parsons is a licensed clinical social worker with expertise in addictions and co-occurring mental health disorders, working predominantly with adolescents and transitional aged youth. She's worked in inpatient and outpatient settings, including clinics, schools, and community mental health settings. She currently works for Stanford Children's Health Child and Adolescent Psychiatry Division in the Recovery Clinic program. Thank you so much to both of you again for your time presenting this morning. Please feel free to begin whenever you're ready.
Thank you for having us today. We can move to the next slide. So navigating substance use and other behavioral addictions. This is what myself and Karen do clinically. We want to start off by talking a little bit about the Recovery Clinic and the services, more specifically the services that we offer. The Recovery Clinic it's 2 years old now. I think it's been a great success. We have lots of patients in the clinic now at this point. We treat youth who have both potential substance addictions and behavioral like processing type addictions. We do see a lot of patients, a lot of teenagers, of course, who have screen addictions, whether it's video game addictions or other possible social media addictions as well. And we consider this what we call a dual diagnosis clinic, meaning we focus on treating youth who have typically both a co-occurring addictive disorder, whether it's a substance use or behavioral addiction, and also a co-occurring mental health disorder, whether that's depression, anxiety, maybe even a psychotic disorder. That's what this clinic essentially functions as and treats. We see new patients up to the age of 18 for new intakes, and then we are able to see those patients as they age up to the age of 25. And you can, this is the link to learn more about the services we offer at the bottom of the slide. You can probably also just type in Stanford Recovery Clinic or Stanford Addiction Services, and both should actually direct you to more information about the recovery clinic if you did a Google search that way for it. We can go to the next slide. Great. I wanted to just point out, if you had interest in services that we offer, this is the intake number, and you just have to reference the recovery clinic, or you could also mention my name or Karen Parsons' name, and that should facilitate or initiate the intake process. Next slide. So what services do we provide in the recovery clinic? So I focus on potential medication management needs, and also provide combination with psychotherapy during my visits. Karen Parsons focuses on individual therapy, and we're really pleased to now have parent support groups, and we also have group therapy for youth. So I think we have a lot of great service offerings at this point. We're always looking to expand the services that we can offer in unique and novel ways. And so yeah, this is what we are able to provide at this time. Next slide. So we wanted to spend a little bit of time just going through what exactly is the criteria for substance use disorder. We get asked this question all the time by the actual teenager patients themselves or parents of teenagers who we have intakes with. You know, do I have a substance use disorder? Does my child have a substance use disorder? So we wanted to actually spend some time and show what the criteria for a substance use disorder is. This is in our DSM diagnostic manual. This is what we look at and think about when we assess for potential substance use disorders. So you see here, there are 11 criteria for potential to potentially meet criteria for a substance use disorder. If you meet 2 or 3 of these essentially bullet points, then that means that you likely meet criteria for a mild substance use disorder. 4 to 5 would be moderate, and 6 or more would be severe. Let's go through some of these bullet points. So some of the criteria can include taking the substance in larger amounts for longer than you meant to, wanting to cut down or stop using the substance, but not managing to do so, spending a lot of time getting, using, or recovering from use of the substance, cravings and urges to use the substance. And there's 11 criteria here. It is kind of interesting. Most of this criteria was not designed with youth in mind. Bullet point 5 does mention not managing to do what you should at home, work, or school because of substance use. But in general, most of this criteria was designed to assess for substance use disorders in adults. But we can, I think, extrapolate a lot of this down to youth. And there have been studies conducted that have indicated that this might seem kind of shocking, but if you have a youth who is using even something like cannabis once or twice a month, that they likely would actually meet criteria for a mild substance use disorder, even if it's only 1 or 2 times a month. So this is what we think about when assessing our patients for potential substance use disorders. Next slide. Thank you. A lot of that criteria as well also applies to behavioral addictions. And yeah, I think a lot of the bullet points and just the actual criteria, we do think about that when assessing for patients who come to us with potential screen addictions, whether it's video game addictions or social media addictions. Take, for example, one of the bullet points about not being able to cut down even if you have a desire to cut down. I think a criteria like that absolutely applies to assessing for screen addictions as well. Yeah, I think we can move to the next slide here. Thank you. So as far as adolescent screen use, most of this information here is from Common Sense Media, which is an organization actually based out of the Bay Area. It's one of the best resources that you can find that actually tracks national data on adolescent screen use. And this is what we typically, what we essentially know at this point about data with screen use with adolescents. So adolescents, 13 to 17-year-olds spend on average 9 hours per day on screens. It is tough. It has become tougher to track this during the pandemic, considering most adolescents, of course, had to use their laptops, computers for school. Even as they've returned to school, a lot of times classes will integrate laptops into the courses. 88% of adolescents at this point own a smartphone, and 95% of adolescents own a laptop computer. 45% of adolescents say they are on their phone almost constantly. 54% of adolescents say they use their phones too much. And 65% of parents say that they worry about their children's screen use. So this is definitely a problem, concern, and this is why we developed the recovery clinic to hopefully treat what really seems like addictive behaviors with screen use. Next slide. Here's some of the health risks that we see clinically associated with excessive screen use. And again, just more reason evidence why we want to really capture these patients and treat them when we can, who have what seems like really excessive screen use. So health risks that we know of, depression. So there have been studies that have tried to actually link how much time someone spends on a screen to correlate that with likelihood of developing an actual depressive disorder. Some studies have said it could be as little as 6 hours a day that could actually lead to increased or higher rates of developing a depressive disorder. Insomnia is another really significant, important health risks associated with excessive screen use. If you're using your phone late into the evening, if you are charging your phone in your bedroom at night, if you are having trouble falling asleep 10 minutes later, you grab your phone and you start browsing the web, going back on social media, it can absolutely lead to insomnia and difficulty initiating sleep, and leading to decrease overall total sleep. This can also happen as well from obesity, thrombosis, embolisms. Of course, if you're on your screen all the time, you're probably not exercising appropriately. We definitely see neck, shoulder, and back pain associated with youth who, again, they're sitting at their desk all day, maybe they're playing video games for hours and hours and hours. we see all these potential health issues, tendonitis, carpal tunnel, other repetitive use injuries, just more reason why we really want to treat and consider excessive screen time as a pretty serious problem that needs to be addressed clinically. And next slide. Okay, and go ahead, Karen.
Thank you. So I think one of the most obvious places to start if you have concerns, whether it's regarding behavioral addiction, screen use, or substance use, is to talk with your child's pediatrician or doctor. The American Academy of Pediatrics does have guidance available for providers to help screen for substance use and addictive behaviors. They also have a parenting website where you can access some tools to try and help evaluate for yourself how much your child's screen use might be interfering with other activities and responsibilities throughout the day. Something I think is really interesting, and we can actually share this link down in the chat if it's possible to copy and paste it. When I ask teenagers to do this media plan where you go through and plug in, how many hours are you in school, how many hours are you sleeping, they're not great at estimating their time. And in particular, estimating the amount of time that maybe you take to travel or preparation. And so I think it actually can be very interesting for parents to do this and for children to do it as well, and to have some comparison. It's an opportunity, I think, for parents to teach a little bit more about organizational and time management on top of really looking at, is the amount of screen time you're using every day realistic with all the other responsibilities that you may have, such as going to school or getting proper sleep. And so that's healthychildren.org, and it's offered from the American Academy of Pediatrics. Next slide, please. So after your child is screened potentially by their pediatrician or family doctor, there are a set of outcomes that are possible. So one is that, in particular with substance use, it may not be present, and we want to continue to provide some positive reinforcement for that. And so, I'm not sure what happened. The next possibility is that there's a more experimental or infrequent use of substances. And there are actually interventions that your primary care pediatrician can provide to try and address that. A really sort of essential follow-up is having some type of monitoring if that's what's indicated. Mild to moderate and severe substance use disorders, can be treated through a variety of motivational interventions and referrals into different levels of care. And then, of course, the other piece is that we look at what's the acute risk of harm. So, for example, if your child was exposed to a pediatrician, very risky use or use that maybe has a potential for overdose, that they might want to actually really address that aggressively within their office or through an emergency department. So just kind of, to be aware that there's sort of a spectrum of responses indicated by what's disclosed. Next slide, please. No matter what level of care you may enter with a substance use provider, the first thing to expect is that you will have to go through an intake process, an assessment, just like you would if you were receiving any other type of mental health services. In addition to trying to establish the criteria for substance use disorders that Dr. Zicherman reviewed earlier, the other thing that clinicians are really going to try and take a deep dive on is what is the sort of levelness, or level of readiness to change. If we have somebody who is really, ready to change their substance use and stop using today, we might approach that differently than someone who is either in denial about their use or really actively admitting that I have this use and I absolutely do not want to stop. That would really change the level of care that they may be able to enter. Similar to adults, for very high level programs such as residential treatment within California, there has to be some willingness on the part of the adolescent to stop their use as part of their admission into these programs. Next slide, please. And so here's some typical levels of care for those with substance use disorders. So some people are treated in outpatient with psychiatry and individual or group therapy. Intensive outpatient programs are usually offered a couple of days a week and have a combination of groups, individual, and family therapy. They tend to have a focus on building skills, such as relapse prevention. And then often when adolescents are finished these levels of care, they would still follow up with an outpatient level of care to help with them maintaining the changes and the skills that they built within intensive outpatient. The same is true as partial hospitalization. It's just a difference in the amount of hours per week. And where partial hospitalization, you're attending many hours per day, usually around 19, 20 hours a week of treatment, but the benefit is you're still within the home environment. Residential treatment facilities are available for youth who have substance use disorders, and they do usually require commitment for change in order to be admitted. They typically run 30 to 45 days, and they're really looking to provide some stabilization as people work through potential like withdrawal periods and get them ready then to move into lower levels of care. Medically managed intensive services are for patients who generally really need to have like some type of withdrawal management, or they may have other co-occurring either mental health or physical health issues that really require a higher level of medical monitoring while they're receiving their treatment. This is not a common level of care to be needed for adolescents, but occasionally this is something that may be required. And withdrawal management is just basically looking at like how to provide some treatment while people are adjusting. So if you have a very severe substance use disorder and you've stopped using, you might expect to have like some pretty severe changes in sleep, in mood, and those can really impact your ability to participate in a meaningful way in a lower level of care. So occasionally we do have youth that really do need to have a period of time receiving withdrawal management services so that then they can tolerate and participate in a meaningful way in some of these other levels of care. Next slide, please. So here's some sort of universal strategies to try and minimize screen time with your teenagers. And so designating screen-free times and screen-free zones within the home can be one way to do that. Setting standards around daily exercise and receiving adequate sleep is also very important. And the last thing there I mentioned is that like modeling healthy screen use to your children is certainly a big piece of trying to minimize screen time. In order for kids to have some buy-in around reducing or changing their own habits, parents providing that modeling of healthy behavior can be very, it can be not just helpful, but also it can help to avoid conflict around like, why is my screen time requirements different than yours? Next slide, please. So substance use prevention. So the American Academy of Pediatrics does have some guidance on strategies for parents in order to help prevent the use of alcohol and drugs. And one of those is actually trying to have like open conversations with your children about drugs and alcohol. I think that can be very difficult sometimes for parents to feel comfortable to approach their children and how to have these conversations, or sometimes it even may seem that kids have very different information or even more information than a parent might have. And so I think as a standard that you're approaching this as a parent, you do not have to be an addiction medicine expert in order to talk to your kids about drugs and alcohol. Because what we're really trying to instill are expectations and responsibilities, right? Versus say having like a rich like scientific debate. And so being open to talking to them, I think really does help with setting some of those standards. Having some clear expectations and rules around substance use, I think is also essential. And modeling responsible use in front of your children as well. Kids are definitely notice like how people in their families use substances. This is a common like assessment question, and we often talk about with the youth in our clinic is that like what happens say at family parties, or what do you see like within your own home? Because if they're modeled that like really high rates, say for example of alcohol use, then they think that that's the way that you are supposed to drink, is versus like if they're being modeled moderate use. Correcting extreme beliefs can also be really helpful. And so, for example, I think one of the most common things that we hear from youth is that like, cannabis is okay because it's natural, right? It's of the earth and it's just a plant. And so that's an extreme belief to hold, because there's many things, right, of the earth that are not safe or helpful, such as like swimming with sharks or rolling around in poison oak. And so there's definitely ways to try and engage your child and kind of tease out like what are some of these like more extreme beliefs that they really have. If I fundamentally believe that something is just not harmful and not a big deal, then it's very difficult, I think, for them to really accept like boundaries around it. And the last thing is trying to avoid entertainment with your child that really glamorizes drug and alcohol use. And I think that's becoming like more prevalent in some of the newer, like shows that are available. And so really trying to have conversations around, is it satirical versus, right, really glamorizing. Next slide, please. So how can parents support adolescents? And I think even before that is what are some of the really sort of key features of that? As Dr. Zicherman mentioned, the criteria for substance use disorders was really developed with adults in mind. Adolescents living in the home have a number of protective factors that are built in that really keep them from feeling all the potential or experiencing all the potential criteria of substance use disorders. They don't have to support themselves. They don't have to go to a job every day. And this might allow like more use in a way that they don't feel that harm. One thing we do see though is that almost every patient who comes into our clinic have strained family relationships as a result of their drug and alcohol use. And so this is a good way, I think, and a good starting point of how to address and motivate some change. It's really essential then that we think about if there's family conflict as sort of a norm for adolescent substance use and behavioral addictions, that we don't want to only focus on and treat the adolescent, but that instead providing some support, intervention, and treatment for parents on how to address conflict and communication dysfunctions within that relationship and to make improvements is really essential. And then the other piece is how can parents start to really drive and foster motivation within their child to accept help? That's a huge challenge, right? Because I think we're often approaching it as more of a discipline issue. And although that is a piece of it, that if we want our adolescent to change, then we also have to figure out like how can we sort of like join everyone together and have some agreement on how to move forward. Next slide. And so in the parenting education support group that is going to be coming up, one of the things that we're going to really focus on is really trying to further understand what might drive adolescent substance use and behavioral addiction. Some kids have experimental use and others have like a much higher level of use, or the amount of time spent like on screens or gaming is incredibly high. And so for some, it may be that this is providing some other type of need or sort of like an ill attempt to cope with something else, which is why we treat co-occurring disorders, including depression, anxiety, and ADHD within our clinic, because we see that kids, they want to feel better if they're anxious. And sometimes, right, getting high or being on my phone all day provides a level of distraction or like an immediate reward, right, in reducing my anxiety. But then there's long-term negative consequences for the amount of use that they have and that they might not be able to really say function as a student or within their family without conflict. The other thing that we're going to address and assist families with is really looking at like how can you build communication skills through practice in order to engage your adolescent. High conflict is pretty typical for our patients, and so and of course kids should listen to their parents. That's an absolute standard, but what we find is that sometimes the approach that's being used is just not producing the result that you want. And so I think that looking at like how much you shift your communication can be really beneficial. And in particular, we're going to do a deep dive into a model called community reinforcement approach and family training, support and prevention. And it really has in mind like how to try and approach people who are using substances or have behavioral addictions and help motivate them to change and accept treatment. And so I think we've reached the end of our slides. We'll be able to move on to any questions that anybody has at this time.
Thank you so much, Karen, and to Dr. Zicherman for sharing your expertise today. For participants, please feel free to use the chat to ask any questions you might have. One question that often comes up is cannabis safe for use by adolescents?
Yeah, so I can try and answer that. No, it's not safe. I think that's a very sort of quick answer I can provide. And also another reason, going back to the criteria that we look at for substance use disorders, another reason why I do think it actually is, even with once or twice a month use of something like cannabis, for instance. Another reason that I think we have to factor in why those youth can potentially meet criteria for a substance use disorder, even if it seems like it's not very frequent use, is because we know that with the developing brain, there are a lot of potential consequences, even with limited use of cannabis. And the fact is, cannabis use at 16 or 17 is going to be different than cannabis use if someone is in their 20s and their brain has already gone through the significant developmental periods.
Thanks so much. And I guess along those lines, many parents wonder, should I allow my teen to use at home, whether it's drinking or cannabis use or whatnot, so at least I can monitor them?
We never encourage that. Again, because we just know that there are problems with whether it's cannabis use, well, particularly with cannabis use and the developing brain, that it's just not a good idea for any level of use to be encouraged or supported within the house, and also for other potential developmental issues as well. Issues with, we know how cannabis can potentially affect academics. And another point I wanted to highlight too is that to the best of my understanding, and I look up this information frequently, there's not a single academic oriented study with youth and something like cannabis use that actually shows any potential benefit for mood or anxiety levels if there's actual long-term use going on. So I do hear from parents, is any level, can I support my teenagers' use? They say it helps them cope with maybe some depression or anxiety symptoms. And my response is a firm no. It's not something that I would encourage a parent to support. Same thing with alcohol or any other substances, honestly. Karen, did you want to try and answer that question from your perspective as well?
Sure, I can add. And first I want to say I completely agree. And in my own practice, I have not seen anyone who has had a true reduction in symptoms from depression or anxiety with cannabis use. I do think that when people are under the influence and they have a certain amount of relaxation while they're currently in that state, but that it doesn't seem to have a carryover or curative effect over time. So we don't see someone who would rate their anxiety, say an 8 or 9, and then they get high, and then eventually they're hitting lower levels, as you might with more traditional treatment methods such as CBT and medication management. And the other thing I want to point out is that I think that there's also this idea from some parents that this helps reduce risk because it's less risky, if they're in the home or they're not driving. And I haven't seen much carryover in terms of if I could use within the home, then that would prevent me then from going out in the community or attending a party or getting high in my friend's car at a park. And so we don't. And I think that just sort of speaks to the developmental phase of teenagers, that it's not really, I don't think it's really true that having a safe space for youth really mitigates risk in other situations on other days.
Thank you. There's a question in the chat asking about CBD products. What are your thoughts on those?
Sure, I'm glad that question is asked. It comes up all the time, honestly, when I work with teens and parents. Is it safer to use than products with THC? Yes, CBD doesn't have the sort of psychoactive components of THC. However, it absolutely needs to be studied more. Long-term effects as far as mood, anxiety levels with teenagers, we don't have a whole lot of data or really good scientific investigations about that. I will also comment that it's also probably safer from the standpoint of there are CBD formulations that have been FDA approved for the treatment of other conditions, like I believe certain seizure disorders. But as far as use of CBD products in teenage mental health, for instance, I don't recommend it. If there are some circumstances where potentially as a harm reduction measure, it might make sense if you have a patient who has very notable, and I would say chronic severe THC use, maybe there's a situation where it makes sense to try and get them transitioned to CBD products instead if other measures haven't worked essentially. But still, in general, I do lean away from the idea of encouraging teenagers or saying using CBD products with teenagers is okay.
Thank you. Another common question that comes up is, how do I know if my teen or my adolescent is under the influence? And what should I do if I do notice some signs?
Yeah, I can try and answer that one, and then Karen, you can probably also helpful to jump in as well. I think different perspectives in that question is helpful, actually. Yeah, I think if you notice any changes in behaviors, if you notice any sort of suspicious attempts at, maybe you have concerns all of a sudden, like your teenagers maybe trying to sneak out of the house or just being deceptive, and they don't usually act that way. I think that can certainly be a sort of a data point that maybe something is going on. Of course, if you smell, cannabis products, potentially that's an obvious sign. But also, if you feel like there's attempts made to maybe cover up an odor, that can certainly be a sign as well of use. But I would lean more towards behavioral changes as a potential warning sign that maybe substance use is going on. It doesn't mean the substance use is going on, but it certainly can be a potential warning sign of substance use. What do you think about that, Karen?
Yeah, I agree. I think that behavioral changes is the first thing to look for. And then I think something that's important to consider is just like how families might store things as alcohol or certain prescription drugs or cannabis within their home, and kind of looking at like, do you have to restrict access is one thing that parents can try to do. But I think that also parents don't have to, it's not necessarily just about catching your child under the influence, but also just really looking at like, is there consistent behavioral changes, or, are they often like slurring their words, or right, like their maybe their motor skills seem off, and because it's happening on a really frequent basis, that this might be just a flag to maybe to talk with their pediatrician about as well.
Yeah, and potentially maybe if there's hearing some feedback there. Maybe potentially if you find that your teenagers hanging out with a different group of friends, all of a sudden there's like a precipitous academic change. You find out that from school that maybe they're ditching school. These could all be potential signs that substance use is going on. That doesn't mean that substance use is going on, but it certainly could be evidence that it's happening.
Thank you. And if parents are concerned, should, lots of parents ask, like, should I search their room? Should I search their backpacks? Um, what should they do?
So I think looking, right, like looking for substances and trying to locate them doesn't necessarily give you like an absolute like data point on whether or not your child is using substances. And so usually my first question back is like, well, if you find substances, what will you do? And if you don't, what would be the next step? And so I think that really, like trying to keep like in communication with your child, and then also sometimes it can be very beneficial for parents to approach school staff and teachers and to try and discern, like, are they seeing the same behaviors at school, or is there an issue with, say, school attendance, or has their academics really changed? I think that having a clear idea of like what step you'll take after you find substances is also like really important. And I think for most parents that trying to connect with their medical provider is like the natural like next step if they do find substances. But I would encourage you to continue to monitor and pay attention to any sort of changes you're noticing if you don't find substances.
Yeah, trying to play a sort of gotcha game with your teenager, it almost always backfires. Um, I think it's important if you do find that if you do end up knowing that your teenager is using substances. I think first time that you sort of confront them, I wouldn't even use the word confront. Maybe I'd just say I think it's important to have a healthy conversation and offer support. And then, like Karen said, I think is a really important next step to actually get a medical evaluation. That can be as simple as just bringing it up to the pediatrician. I think that's usually a really good gateway for a larger discussion about potential substance use.
And there's a related question in the chat about that. A parent is wondering, how does talking with a pediatrician help when cannabis use is detected or there's a concern? I guess they're just wondering, like, how is a pediatrician helpful in that process?
Right. So I will say that the role of a pediatrician, hopefully most pediatricians know this, they might not in California, but substance use is considered protected information. So just because you bring your teenager into the pediatrician doesn't mean that they will then be able to reveal what level of substance use might be going on. Hopefully, maybe there's a conversation about trying to be open and maybe facilitating a conversation about that with the pediatrician present. I think that would be great, but that is considered protected information. Most pediatricians nowadays have training in at least brief, what we would call motivational interviewing or motivational interviewing essentially. And while they don't usually have much, maybe like dedicated sort of like weekly follow-up and therapy for a teenager who might be using substances, they are at least able to do good screening, have some brief and important conversations, and figure out if from that point forward, if a higher level of care or further support might be needed, which would usually involve a referral to either a therapist or potentially like a child psychiatrist, or maybe an adolescent medicine specialist.
I think the other part that's helpful about talking with the pediatrician is that it does seem that most adolescents do believe and trust the information that they get from their pediatricians. A lot of kids have had very long-standing relationships with their pediatricians, which it really does. That relationship makes a difference. I think it also provides parents with an opportunity to approach substance use and behavioral addictions as a medical issue, right? And so when we think about like if we're only approaching substance use in sort of the terms of like I'm looking at it as like a discipline issue, right? Like you violated a family rule and now you will be punished, versus like also trying to think like is there something else going on here that we might really need to try and assess and tease out and then address appropriately. So just like you would any other like medical issue, you often do start with your primary care physician. It also, I think, gives parents a space to take on a supportive role as well. So if it turns out that your child does, for example, meet criteria for a substance use diagnosis, but then you're playing the part of a family member providing support, and that you can often kind of refer back to like, well, this is what the doctor is recommending, or this is what the doctor is suggesting. So it's not just that, right? Where sometimes like it's coming straight from the parent, it just creates like conflict and argument around like there's nothing wrong with my use or like everything's okay versus like, hey, like we saw the pediatrician, they really think that you should try to do something differently or that you need treatment, whether it's by high use and into a residential treatment facility or something lower.
I really like hearing how you phrase the idea of entering treatment, or rather having an evaluation with a pediatrician. It sort of medicalizes the issue essentially, and I think that's a really important step to take.
Thank you. And then going back to screen time, is all screen time the same? Should parents view educational screen time separately from other screen use? Lots of parents seem more open to allowing their kids to watch things or be on screens if it's related to educational content.
So this is an evolving field, and we absolutely need to study this more. I would say screen time, including screen time for schoolwork, I do consider that as part of total screen time. Even if you're using a computer for laptop for educational purposes, how many times do you have other browser windows open? Do you have your chat window open? Are you looking at a screen where there's so many different simulating things going on? And we do have some interesting evidence coming out that shows that using screens an excessive amount, regardless of what kind of activity you're doing, just using screens can actually potentially induce states of ADHD in individuals that might not actually otherwise ever develop ADHD. So it actually can potentially rewire your brain circuitry, essentially. And we also are finding out even very recently that there really are some differences with video game addictions versus social media addictions. You don't have to look any further than some of the information just came out with Facebook, where they have the data that actually shows that, particularly with female gendered teenagers, that they are at much higher risk of mood disorders, suicidality, and other mental health issues compared to the general population. And that was very specific towards female gendered teenagers, the data that they actually have on the matter of using social media. So I think there are some differences. Also, at the same time, I think in a lot of ways, there are a lot of sort of global similarities with screen time as well.
And then if there is excessive screen time use or there is substance use found, should parents just take away devices? Should they use punishment? How should they respond, aside from going to the pediatrician initially?
I think that trying to take away devices, or even if you do that for a period of time, it often doesn't really address like any of the sort of like underlying like reasons why this might have occurred in the first place. And so if somebody is, gaming 6-8 hours a day, if you take the device away for a week or two, and then give it back, like, will there be like really any like behavioral changes sometimes what you see is that initially for a few days, there's like a really strong adherence after being punished. And then after that, that adherence to rules and contracts that are made with parents tend to fall off. And so I think that instead, trying to come up with ways to really help like implement and practice and internalize boundaries around like how to use those devices will have more success in terms of carrying over time versus just punishment, right? Like if we're and I think the same is true for substances. And of course, like the with substance use, I think you have to be like in particular also like very kind of like mindful around like what's the substance that we're talking about, and saying like if you restrict your child from going out and you're doing a lot of close monitoring, will you be able to sustain that long enough? Or is there other sort of like underlying factors that or like reasons why they use? And if those are left unaddressed, then you might see like a lapse in use again. And unfortunately, because access to drugs and alcohol is just, it's very easy for teenagers here in the Bay Area. Like most, I think like most teenagers would tell you if they want to, you know, if they want to use drugs at school, then it's readily available, unfortunately. And that's true like in both public and private schools and really small school settings.
Yeah, and we don't like to really refer to it as punishments. That I think we consider consequences, and absolutely there is a place for consequences when it comes to substance use. There can also be rewards as well, and we haven't really talked much about drug testing, but you get asked a question about drug testing quite frequently. And drug testing can certainly be appropriate, home drug testing, but it works best if it's not in a punitive way. If it's actually used as like a supportive and powerful way for the youth themselves to actually show and prove that they're not actually using a substance. If it's used again as sort of like a gotcha detective type tactic, it doesn't, the outcomes are not going to be very good, and it's not going to lead to building a better relationship with your teenager ultimately. And then that also means, you know, you can also have systems and contracts in place that show that, hey, you know, if you do show us that you have, you know, clean urine drug screens for a certain period of time, then maybe we can talk about some external rewards. So it's okay to have consequences. It is also okay to reward wanted behavior as well.
Thank you. Another question that comes up often for parents is, should they just shut down the Wi-Fi at a certain time at night and make sure the devices are out of their teens' rooms? Your thoughts on that?
I do think that having devices removed from rooms at night can be like a really good strategy in terms of like minimizing like time on it overnight. If you know, we, as Dr. Zicherman mentioned earlier, we do see a lot of teens who talk about, you know, like I woke up for a few minutes and I got on my phone, and you know, does that really prevent them then from going back to sleep? I think in most cases it does, and often like a lot of kids would probably stay in bed and return to sleep a lot sooner. And in the same vein, right, like looking at like just like shutting off the Wi-Fi at night and like setting that like really hard boundary, I think that that can be very effective in some households, but you may also really want to consider like, are there other types of like say like co-occurring like mental health issues going on, or like what would be the potential consequence if you turned off the Wi-Fi, and behaviorally can your child and you manage that together? And so for and you might need like more assistance around like how to implement that like in a really like safe way. But I do think having some clear boundaries is really essential, and that if there's none, right, the kids are not likely to elect on their own and say like, okay, I'll just, you know, I'll definitely just get off the Wi-Fi every night at 11 p.m. because I should and it's good for me, right? The kids can be very sort of present focused, and when they get very involved like with gaming or screen time, it's they're too focused on that to really think through like, you know, like the negative consequences, say being really tired at school or not performing well. That just might be a little bit further beyond like where they're really at.
Yeah, and I think they can potentially be really good and effective measures. I recommend the idea of charging a phone or electronics outside the bedroom to almost all of my families that I work with. Some of the families, again, like Karen said, a hard set time for turning off the internet that can work, but it's not going to be probably helpful for every family. And we'll say whether it's the hard deadline of when the Wi-Fi turns off, or the idea of charging screens, electronics outside the bedroom. Absolutely, these interventions are going to work best if the parents are also buying into it. If you're willing to model that behavior for your teenager, your child, it's going to be a much more effective strategy. If you're not willing to actually also, turn off your laptop, stop sending emails for work at 11 o'clock at night, if you're not willing to charge your phone outside your bedroom, it's not going to go very well, I think, at home if you try and implement that with your teenager or child.
Okay, thank you. So the last question is, what are a few of the key factors to prevent adolescent substance abuse?
So there's a study that's conducted every year called Monitoring the Future, and it looks at adolescent drug and alcohol rates, everything from experimental to more regular use. And so one of the things this shows there is that most American teenagers are going to have at least some experimental use of drugs and alcohol. And so I think that having really open dialogue around expectations is really essential. And I think that also, and clear boundaries, but at the same time, like, you want to try and approach this in a way where it doesn't come across as so punitive that your child would never come and talk to you about it. The other part, I think, that is also just looking at and modeling how you might use alcohol or cannabis within your own home. And so if kids are sort of exposed to, or drug and alcohol use is really normalized for them, then I think it does make it more likely for them to have their own use.
Any last thoughts for you, Dr. Zicherman, there?
Can you repeat I know it was a very brief question. Can you repeat it one more time?
Sure. The question was, what are the key factors to prevent adolescent substance abuse?
Yeah, so I would really just echo what Karen said. I think modeling behavior is really important from parents to their teenagers and children. If you don't want your child using alcohol, then don't use alcohol yourself in front of them. I mean, that might not be realistic or feel realistic for most adults or families, but it's just, if you are using alcohol in the home, if it's around, then quite simply your child or teenager is going to be much more likely to use it. And I think trying to have healthy, open dialogues, potentially even before you have concerns about substance use, is important. As early as 6th, 7th, 8th grade, I think you can actually start to educate in a preventative way your teenagers and children about substance use.
That's a really good point. I think it's very typical for most of the patients we see that their initial age of use is probably somewhere around the beginning of high school, 14, 15 years old. And so you really want to have this conversation before they're already using, because often then they've had time to form a really strong, belief and opinion around substance use that's not as flexible as it is earlier on, such as in middle school grades.
Yeah. Thank you. So I think that this last question in the chat relates to the group that Karen's going to be running, which is, a child doesn't want treatment for cannabis use. Does mandatory therapy work? Is it suggested? And I think Karen's group is to help support parents who are in that very situation. Is that right?
That's absolutely the intention of the parenting group. There are evidence-based and pretty well-researched treatment protocols for kids who do not want to change or stop their use. The drawback is that, of course, that they can take longer than a child who's really ready to change. And so I think that it's really essential if your child has substance use and you're seeking, like, say, an outpatient individual therapist in the community, that you want to talk to them about, like, how do they address kids who don't want to come into treatment, or kids who are saying, like, well, maybe I'll go, but I'm no way I'm going to stop using, right? Like, you want to have that conversation up front. And if somebody doesn't have a way of doing that, then that's probably not the right provider to work with. You want to work with somebody who feels like they can work with those who are not ready to change yet.
Yeah. And for more information, please look into signing up for Karen's class. That's starting, I believe, next week. Is that right?
Mhm.
Okay. All right. Well, thank you